Good morning, everybody. Great to see you guys all here. Thank you so much for joining us today. I want to welcome you again to the quarterly awards recognition ceremony that we hold each quarter for our employees to recognize our dedicated employees for their contributions to serving our nation's heroes. My name is Ruth Hatchwell. I'm the Veteran Experience Program Manager in the Employee Patient Experience Service here at the Cleveland VA. Our department is designed to enhance our employees and our veteran experience and to ensure we continue providing world-class care to all of our veterans. I would like to welcome our awardee service chiefs, managers, supervisors, and anyone else that is here to support them, as well as our executive leaders who've come to honor you and to recognize you as employees and as award winners. Following the ceremony, we will have a celebration at the end with some beverages and snacks, and please stay to enjoy that, and let's enjoy the show. So I would like to welcome Rob Jastrom, who will be providing us with some opening remarks. Thank you.
Well, good morning, everyone. A last-minute fill-in here. We do have a bit of a bug that is running through the ELT. Tim has a bit of a cough, so he wanted to keep things safe. I feel great, so no worries there. I'm just excited to be here. And really, today is all about you guys, all of you that have poured your lives into this organization. And just looking at the honorees, a couple things jump out to me right away, and that's commitment and people that care at the highest level. And that's really something that I think embodies our organization. You look at, private sector healthcare organizations, they stay at those organizations for between 3 and 5 years. That's the median. Here, we're celebrating people that have been here for 20, 30, 40, sometimes 50 years. For folks that have really just poured their lives into this place, and it's just an honor to be here today. I know that, in the past, people have come up here and been a little bit nervous. Today is not the day to be nervous. Today is the day to celebrate, okay? So breathe easy and just relax. This is all about you, and I really thank all of you for being here. So let's kick things off and have some fun.
Thank you, Mr. Jastrom. Good morning. My name is Catherine Bird. I'm an education instructor in the Employee Patient Experience Service. I would like to welcome you all here today, especially our awardees. This is an exciting moment for you and a proud moment for us. It is my honor and pleasure to be your mistress of ceremonies today. We will now begin presenting our first awards, starting with the Length of Service Awards. VA Northeast Ohio Healthcare System appreciates its employees. Employees make VA not just a job, but a career. It is essential that the VA has experienced and knowledgeable employees to support the mission of the VA. VA Northeast Ohio Healthcare System acknowledges employees with service awards based upon the years of service that an employee has worked at the VA to demonstrate its appreciation for these employees. I am privileged to call up these employees to receive their Length of Service Awards. Please hold your applause until the employee in the service group listed have been announced. Mr. Jastrom will honor these awardees from the Director's Office. 20 years, Glenn Myers, Compliance. Dr. Susan Raffaelli, Acting Chief of Staff, please join us at the podium to honor these awardees from Diagnostic Imaging, Medicine, Mental Health, Neurology, Physical Medicine and Rehab, Specialty Care, Spinal Cord Injury, and Surgical Care. 45 years, Dr. Nadine Lawrence, Chief of Staff. Years, Sybil Marca, Mental Health. Dr. Elizabeth Pihak, Mental Health. Bernardo Sanchez, Physical Medicine and Rehabilitation Services. Rosalind Schuler, spinal cord injury. "25 years, Troy Koval, mental health. Corinne Morgan, mental health. Alex Santiago, primary care. 20 years. 20 years, Susan Arsenault, PM and RS. Elma Barron, specialty care. Oh, sorry. Oh, Elma Barron, specialty care. Jonathan Baskin, surgical care. Mark Canna, mental health. Timothy Heron, mental health. Frank Giacono, specialty care. William Janik, medicine. Renee Minotti, mental health. Celeste Meir, diagnostic imaging. Shireen Nelson, diagnostic imaging. Dennis Olivares, spinal cord injury. Venkata Krishnan Rajaram, primary care. Boravan Shatalasuk, diagnostic imaging. Thank you, Dr. Raffaelli. Mr. Jastrom will stay at the podium to honor these awardees from Facilities Management and Health Informatics. 20 years, Melissa Karish, Health Informatics. Donald Wood, Facilities Management. Ms. Katina Stone-Jones, Associate Director, will honor these awardees from Logistics, External Affairs, and Food and Nutrition Services. 40 years, Shelley Gill, Logistics. 30 years, Brian Wills, Logistics. "25 years, Karen Maffey, Nutrition and Food. Sherry Moten, Patient Care Administrative Services. Angela Sims, Patient Care Administrative Services. 20 years, Daryl Bishop, Logistics. Risa Connor, Nutrition and Food. June Knowlton, Volunteer Services. Thank you, Ms. Stone-Jones. Mr. Jastrom will honor these awardees from pharmacy and the VA outpatient clinics. 40 years, Terry Kane Jr., Akron. Terencita Horn, Twinsburg. 35 years, Joyce Kravinskis, Wade Park. 30 years, Jacqueline McHugh, Akron. Deanna Munich, Akron. 'Richard Pompa, Pharmacy. 25 years, Monica Franklin, Wade Park. Kim Hamley, Parma. Sherry Neeson, Wade Park. "20 years, Heather Lynn Bartholomew, Wade Park. Tammy Kepler, Akron. Mary Matani, Pharmacy. Colleen Rittenauer, Sandusky. Jose Salcedo, Independence. Sorry, my apologies, okay. So Mr. Jackson will honor these awardees from the Environmental Services Management. 25 years, Christopher Bagley, Environmental Management Services. Al Cooper, Environmental Management Services. Okay. Mr. Jastrom will honor these awardees from Nursing Service and Sterile Processing. 30 years, Dina Gilbert, Mental Health. Vivian Thornton, Spinal Cord Injury, Rehab Education. "25 years, Tammy Jimerson, Spinal Cord Injury Rehab. James Salford II, Ambulatory Care. Heather Tracy, GEC. 20 years, Yolanda Shanoin, Spinal Cord Injury Rehab. Furman Quiones Villanueva, Spinal Cord Injury Rehab. Thank you. Let's give our Length of Service awardees a round of applause. It is now time to congratulate the award recipients of the following awards: Daisy Nurse, Sunshine Award, Great Catch Awards, Employee of the Month, Eye Care Individual Awards, Eye Care Award for Serving Leadership. Mr. Jastrom will be at the podium to present the Daisy Nurse and the Sunshine Awards. The Daisy Nurse Award. The Daisy Nurse Award is an international award that recognizes the superhuman work nurses do for patients and families every day. This award gives staff, patients, and families a way to express their gratitude for the compassionate environment nurses provide. Their exceptional and compassionate care is demonstrated by the VA's core values of integrity, commitment, advocacy, respect, and excellence. All VA Northeast Ohio healthcare system RN and LPNs are eligible for this award.
Good morning, everybody. I think it's still morning. All right, so I'm just going to read the nomination for the Daisy Award winner from this past quarter, and it's Colette Sample-Sheely, Wade Park Primary Care RN. She was nominated by one of her fellow physicians, and I'm just going to read the nomination. Colette is a phenomenal, very caring, and highly intelligent nurse who is always focused on excellent patient care and safety. She has tremendous concern and patience for our veterans and a unique way of communicating that helps them understand the complexity of their care and ensures follow-up. One example was a patient who had alarming, significantly enlarged aortic aneurysm noted on imaging. He needed urgent surgical evaluation. He was called several times by his physician to convince him to go to the emergency room and to get the urgent evaluation he needed. The patient, however, absolutely refused. Colette happened to overhear this call and asked to speak with the patient. After a discussion with the patient in terms he could understand, she presented a very clear explanation of the problem, the needed treatment, and the consequences of not heeding medical advice. Sure enough, the patient was agreeable to head to the nearest ED for admission. He was admitted and he got the aortic repair he needed. She saved his life. She's truly wonderful to work with, highly motivated and intelligent. With over 20 years of nursing experience, she continues to bring a wonderful attitude and exemplary work ethic every day. I am so blessed to be working with her, and the patients are very fortunate to have her as their nurse. Please congratulate Colette.
The Sunshine Award is a recognition program unique to VA Northeast Ohio healthcare system. It helps recognize our outstanding nursing assistants, surgical, and healthcare technicians who support VA nurses in caring for our nation's veterans. Nursing support staff are a vital part of the healthcare team. They partner with the RNs and LPNs to provide direct care for patients of all backgrounds. Patients and families often share stories about how these employees provide exceptional care and help create a safe, comfortable, and healing environment. The Sunshine Award offers a way to recognize these individuals for their remarkable care they deliver. All VA Northeast Ohio healthcare system nursing assistants, surgical, and healthcare technicians are eligible for this award.
All right, so our honoree this time around is Patricia Cotton, nursing assistant from the ER, and I'm going to read her nomination, which came from a patient. And it reads, I came through the ER pretty beat up mentally, emotionally, and especially physically. At first, Ms. Cotton was always there with an extra warm blankets, a smile, and an encouraging face or a compliment, uplifting, comforting statements that was never a moment too soon or too late. Many times she tucked me in when I cried tears of shame or fear and told me I was going to be fine. She always made it easy to be honest about everything I experienced, and I felt comfortable to pray in front of her, and she never judged me, even when I told her that I lost everything. All my clothes, shoes, toiletries, soap, hair care, everything. She donated things from home and brought them in and gave them to me, including shoes, clothes, hoodies, and socks. I was and am shocked. It's not just the things, it's always been who she is that makes her a superstar in my eyes, and I want to be like her one day. Okay. So just join me in congratulating Patricia Cotton.
Thank you, Ms. Natalie Palmieri. We will now present the Great Catch Awards for Quarter 1, 2024. Patient safety reporting is important to improving patient care, decreasing adverse events, promoting awareness of possible adverse events, and becoming a high reliability organization. Great Catch Awards are a patient safety continuous improvement initiative to encourage staff to recognize and prevent adverse events. This quarter, we recognize a few employees who received the Great Catch Awards between October and December 2024. Please welcome Mr. Sanad Kovic from Patient Safety, who will present these awards. We would like to congratulate and recognize the following employees for their great catches. Our first awardee, Michelle Stetler, pharmacist, Parma Seebach.
Good morning. For our first winner, our great catch was non-VA electronic prescriptions were placed in the wrong chart. The patient had 2 electronic health records with 2 different social security numbers. Both entries had the same birth date and name. On September 19th, Michelle looked the patient up in Vista. It was discovered that there were 2 patients with the same name and date of birth. She saw there were 2 different addresses and phone numbers involved. She realized that this patient's prescription had mismatched by the system to a different profile. It was discovered that the patient had come in several times in the past 10 days for an antibiotic. That had been mismatched since September 9th. Had this not been caught, there was potential for the patient to continue to have gaps in care and not receive the appropriate medications. Please congratulate Michelle Stutler. Next, we have Teresa Nedelkovic, RN Patient Care Coordinator, Urology. As part of the pathology reporting team, Teresa receives pathology reports for veterans with new urological cancer diagnoses within VAN OHS, which help to ensure timely notification for providers in urology. As a fail-safe, she asked to be alerted to all pathologies sent out to safeguard misinformation for cancer patients. On Friday, November 22nd, she was alerted to the pathology of a veteran she has taken care of in the past. She noticed his diagnosis was different from past notifications and documentation. She carefully reviewed the patient's chart, then immediately alerted the reporting pathologist via Teams. He addressed her concerns and realized there was a transcription error. The error was changed and reported to all services concerned without causing any mistakes in treatment or harm to the veteran. The mistake could have led to disastrous outcomes for this veteran if the wrong med and treatment was administered. Please congratulate Teresa. And then our final Great Catch awardee is Allison Deal, RN Interventional Radiology. We had a veteran scheduled to have an aortogram with runoff in the department on November 19th. For this procedure, they access an artery in the groin, and once complete, the patients are on strict bed rest for 6 hours. This veteran was known to the department, and the last time when he was here, he had difficulty self-catheterizing due to his bed rest and inability to position correctly. When he was scheduled for a follow-up with the same procedure, an order was placed for a Foley to be inserted prior to the procedure. Upon arrival to IR, Allison noticed that the Foley catheter did not have any urine visible in the catheter tubing or the bag. Suspecting the Foley was mispositioned, Allison had a discussion with the procedure nurse, who made the decision as a team to re-prep the area sterilely and investigate. The Foley balloon was deflated and an attempt was made to advance the catheter. Resistance was immediately met and blood was noted in the catheter. The veteran was on aspirin and Plavix at home, so the decision was made to remove the Foley and alert the attending physician for IR. Urology was contacted to assess the situation, and the patient ultimately had to have a new Foley placed to tamponade the bleeding for 3 days. The procedure was canceled since we would be giving the patient systemic heparin and would potentially increase the risk for further bleeding. Please congratulate Ms. Allison Deal. Thank you.
Thank you, Mr. Kovic. Now the Employee of the Month Awards. VA Northeast Ohio Healthcare System strives to recognize individual employees who make contributions in support of the mission, organizational goals and objectives, and VA strategic plan. This monthly award recognizes outstanding employee efforts during a specified period as evidenced by peers, customers, and management. The employees that are chosen for this award are nominated by other VA employees. A committee reviews the nominations and selects the awardee. The next awardees have received an Employee of the Month award between October and December 2024. Please welcome Ruth Hatchwell, Chair of the Employee of the Month Award Committee, who will speak about their nominations.
We apologize, the Employee of the Month pictures, we kind of got them a little mixed up here, so forgive us. Okay, our first Employee of the Month is for October of 2024. Ms. Laurie Cox goes above and beyond consistently. She was aware of a high-risk veteran with food insecurity who was due to come in for an appointment. Prior to the vet coming into the clinic, Laurie coordinated with a primary care social worker and communicated results to the team in case she wasn't available. She made sure to have a food bag and a bunch of resources available to him when he presented at the clinic for his appointment. She owned the moment and exemplified the eye care principles for this veteran, making sure his needs were met. Please congratulate Ms. Laurie Cox, registered nurse in mental health at the David P. Winder VA Outpatient Clinic. November 24. As we already shared before the story, Ms. Teresa Nedeljkovic, registered nurse, demonstrated persistence and attention to detail, going above and beyond to prevent harm to our veterans. She has also been awarded the Employee of the Month for her intervention related to the transcription error. Our December award winner, on December 4th, 2024, Ms. Renate Gazuski, LPN, placed a clinic visit reminder to call a patient. The patient sounded despondent and made concerning statements regarding suicide, then abruptly hung up. Renate called the Veteran Crisis Line and the VA police to seek advice in handling the patient's situation. The VA police called and requested the local police to make an immediate wellness check. She again called the patient back to keep him on the line. He conversed with her briefly and again hung up. She contacted the patient's sister, who was his next of kin, who also lived downstairs from the patient. There was no answer, so she left a discreet message. The sister called Renate back and informed her that the police were at the door and ended the call to let them in. The sister later called back to let Renate know how the patient was taken to a local ED via ambulance. However, he had injured himself with a minor injury prior to being taken to the hospital. Ms. Gazuski's compassion, persistence, and support of the eye care model and implementation of VHA policy for veterans in crisis saved the life of this veteran. Please congratulate Renate Gazuski, LPN from the Surgical Services Department. Okay, now we're back to the right slides. Forgive us. Our Eye Care Awards are the next awards that I'm going to present. The Eye Care Individual Award recognizes those employees who exemplify the eye care values on the job and are serving as role models to others. The actions being recognized should have occurred during the past 12 months. All staff are considered. Nominations can include both clinical and administrative actions towards patients, peers, or the medical center, and should indicate the specific actions or behaviors that demonstrate one or more of the eye care values. Our first award goes for integrity. Ms. Paige Bradovic. Ms. Bradovic demonstrated exceptional integrity while caring for a veteran who was accompanied by his concerned wife, who disclosed various serious concerns. Recognizing the sensitivity of the situation, Ms. Bradovic listened attentively, ensuring the veteran's wife was heard and understood. She maintained a professional and compassionate demeanor, assuring the couple that their concerns would be addressed with the utmost seriousness. She promptly reported the issue to her supervisor and facilitated communication touchpoints with appropriate personnel and departments to investigate the matter thoroughly. Ms. Bradovic's unwavering commitment to ethical standards and transparent communication underscore her reliability and trustworthiness, fostering a sense of trust and security in the veterans and his wife during the difficult time. Please congratulate Paige Bradovic, registered nurse at the VA Outpatient Clinic. Our next award goes for commitment. Dr. Patrick Till, optometrist. Dr. Till consistently maintains a high level of integrity by treating veterans with dignity and respect when he cares for them. Dr. Till will find a way to ensure the veterans receive prompt and appropriate care associated with any issue. He will double book veterans who need to be seen, even when he has a completely full schedule. And he looks for ways to find and see each veteran, and will stay after hours, even after his tour of duty. A veteran who was having issues with his eyes for a few weeks was frustrated, so he sought care from a non-VA urgent care. On June 24, 2024, Dr. Till saw this veteran as a walk-in at the end of the day. The veteran stated that he was so happy with his care and shared now he has the answer to what was happening with his eyes. Dr. Till delivers first-class care daily. We are lucky to have him. He helps veterans see the world in a better way, and he helps the staff to see veterans through his eyes, reminding us to look at all people individually and with patience, kindness, and a clear lens. Please congratulate Dr. Patrick Till, optometrist from the Optometry Service. Our next award goes for advocacy. Mr. Gregory Means, who's a supervisory prosthetic representative from the Prosthetics Lab. On a Friday, we received notification that one of our veterans with a spinal cord injury that has his specialty air mattress had malfunctioned and was mostly deflated, leaving him lying on the hard surface of the hospital bed. Spinal cord injury staff had put in a consult to have repairs made earlier in the day. At 4:30 p.m., they reached out to the prosthetics leadership via Teams message and call. They heard back from Mr. Means, who had seen the message on his VA cell phone. This is after he was already home from work and just before leaving for his son's baseball game. Despite it being after his tour of duty, he immediately called and set up a process to assist the veteran. Mr. Means spoke with the SCI staff, the veteran's family, the manufacturer for the air mattress, and the prosthetics vendor, only to learn that no one was available to repair the air mattress. He worked closely with tech support and the vet's family to troubleshoot the problem and to try to resolve it together. Since the mattress could not be fixed, he pivoted to the alternative, to inquire if our prosthetics vendor had any appropriate mattress in stock that would be better than a deflated mattress. There were none available, but they did have a therapeutic foam mattress in stock, which does redistribute pressure and would be better than a stock mattress. Mr. Means confirmed that a mattress had been delivered around 9:22 p.m. that Friday night. This decisive action by Mr. Means helped prevent significant worsening of the veteran's wounds and avoided the veteran having to come into the local ED to be admitted for emergency respite while awaiting mattress repair. Please congratulate Mr. Gregory Means, Supervisory Prosthetic Representative from Prosthetics Department. Our next award goes for respect. Lori Cox, registered nurse, David P. Winder VA Outpatient Clinic. Ms. Cox is always readily available to help with the transition of primary care to mental health. She is the mental health nurse and works tirelessly to get veteran patients taken care of in a timely fashion and emergent situations. Ms. Cox knew we had a veteran that had just experienced the tragic loss of her 16-year-old son and was in the clinic with primary care. Within 2 minutes of alerting Ms. Cox, a plan was in place for a mental health appointment for her PCP appointment. She was also set up with a counselor. She made this transition smooth and ensured the veteran was well cared for. The vet did not have to wait at all to be seen by any provider. She was walked by staff from one provider directly to the next to ensure holistic care was given to this veteran. The veteran shared that her needs were addressed and she was well cared for during this entire time. Ms. Cox always demonstrates respect. She speaks in calm, reassuring tones and treats others as she would want to be treated. Ms. Cox strives to provide excellent care. Please congratulate Lori Cox, registered nurse at the David P. Winder VA Outpatient Clinic. Our last individual award actually goes to two individuals. This is the Excellence Award being awarded to Ronald Young, LPN, and James Justice, LPN, both from the David P. Winder VA Outpatient Clinic in Mansfield. A veteran in the clinic verbalized active suicidal ideation and suicidal threat. While the veteran was in an exam room with a mental health provider, nursing heard yelling and responded. The veteran opened the door and as nurses were responding and rushed out, pushing one of the nurses out of the way as he ran towards the nearby exit, knocking the side doors out of alignment. The veteran yelled that he would not go to the emergency room and was going to kill himself. Two nurses, Ronald Young and James Justice, followed the veteran outside. The veteran walked out of the parking area towards a retention pond located adjacent to the entrance exit drive. The nurses thought that he would try and jump into the pond, but he continued walking towards the drive exit, continuing to verbalize suicidal intent. These nurses attempt to de-escalate the situation through conversation, empathy, and encouragement. The veteran attempted to jump into oncoming traffic on the busy street while the nurses attempted to stop him. Mr. Young and Mr. Justice diligently attempted engagement with the veteran until assistance arrived. During all this interaction, the veteran hit Mr. Justice at least twice with his cane. Mr. Justice contacted 911 requesting police assistance, who responded within seconds, stating that the cruiser was in the area. The veteran attempted to push the officers away. Ultimately, officers placed the veteran in their cruiser for his safety. Mr. Young and Mr. Justice exhibited first-class quality care by actively trying to assure the safety of the veteran and all of those involved in his interaction. Please congratulate Ronald Young, LPN, and James Justice, LPN, from the David P. Winder VA Outpatient Clinic. Our next award is the iCare Award for Excellence in Serving Leadership. This award is presented to employees in leadership positions who have demonstrated exemplary serving leadership by creating a culture of trust, fostering leadership in others, mentoring, removing barriers to achieve goals, demonstrating humility, diversity, equity and inclusion, and global awareness, understanding and embedding organizational purpose into day-to-day operations, and demonstrating the iCare values. Our first award is Robert Burse, CRNA, Supervisor in the Anesthesiology Service. Mr. Burse is a supervisor in anesthesiology. He's obvious to all that he puts the needs of the service and the caring of our veterans at the front line for all of his decisions. Mr. Burse embodies the philosophy of servant leadership. One small example is how he adjusted the day-to-day operations and schedules to accommodate the request for anesthesia services throughout the hospital. Mr. Burse always leads by example. He is the first to volunteer to take on additional duties and changes his workflow to ensure the needs of the unit are met. Mr. Burse is also fiscally responsible and has created a schedule that allows for multiple tours of duty within the service. By doing so, he manages to cover all clinical sites while minimizing the need for overtime. As a leader, Mr. Burse fosters the well-being and the professional growth of the CRNA group. He does so by mentoring and providing opportunities to those he serves. As an example, he has been supportive of educational advancements and opportunities to several of our CRNAs who have demonstrated interest. He has created an inclusive environment that promotes the interests, strengths, and safety of those he serves. The results of the 2024 AES speak to a job well done. Please congratulate Robert Burse, CRNA, Anesthesia Service. Our next awardee is Mr. Ryan Amos, Assistant Financial Officer from Fiscal Services. If you are lucky to work with Mr. Amos, you know his sincere commitment to his team, his public service, and his veterans. Mr. Amos exemplifies leadership in the VA mission and in his life. He is a passionate advocate for the VA mission and the VA's commitment in supporting the whole well-being of the veterans. A few examples of his engagement with VA Northeast Ohio Healthcare System's improvement in our care delivery system include implementation and enhancement of HRO pillars, values and principles in his role as the Assistant Chief of Fiscal Services, and as a part of his acting chief position with the Communications and External Affairs, he worked with VACO on securing $2 million in funds to advertise VA Northeast Ohio across Northeast Ohio region to empower veterans to join the VA, and during this time as executive assistant to the associate director, he incorporated holistic approaches into the activities offered by VAMC. Mr. Amos focuses on developing and expanding the culture of trust in multiple sections of the fiscal service. As a result, his team felt safe to speak up, try various approaches to system changes, and independently practice their leadership skills. This led the team to recognition on the local and regional VISN 10 levels. Mr. Amos's goal was to remove barriers and build rapport between veterans and the VA by sharing new qualifications for applications at the VA service eligibility. Subsequently, this enhanced VHA's reputation in the region. Mr. Amos established steps for external changes, engagement with the public, and internal collaboration with communication and external affairs during his global awareness to proactively implement effective changes and support the VA's mission. We often think that healthcare is what happened between the doctors and the patient. Ryan understands that it goes beyond that, playing the key and pivoting role in the President's own United States Marine Band engagement with VA Northeast Ohio's veterans and staff has impacted the quality of care we provide, the impact that day-to-day activities have on our veterans, and he continues to build the culture of trust. Mr. Amos's actions have a deep impact on operations at VA Northeast Ohio Healthcare System. He exemplifies humility through his support of others, mentorship, and advocacy. Please congratulate Ryan Amos, Assistant Financial Officer in Fiscal Services. Holding it backwards. Let's give all of our awardees an applause. I'd like to thank Mr. Jastrom for standing in for our leaders today. We greatly appreciate that. And I would like to thank Catherine once more for being our wonderful MC for today's ceremony. In closing, again, I say congratulations to all of our award winners and to all of those of you who've come to support them, to help them grow and to develop into the people that they are today, and wonderful employees that we really, really cherish. I'd like to invite you all again to join us at the reception at the back of the hall and to enjoy the rest of your day, and congratulations. Have a wonderful day. Thank you, everyone.